I'm Annie Williams, and 4 months ago I had quite a bad accident in the surf. I broke my heel and it bled a lot, and it caused a hematoma that was pressing on my nerve on the inside of my foot, the size of a tennis ball, the surgeon said, and they didn't know what was quite happening. I was in emergency for 4 hours and lots of drugs and things didn't respond to any of that. So they realised the nerve was getting pressured and it was trapped, so they had to do a fasciotomy to open up the foot and release the hematoma. The surgeon said the nerve was unrecognisable, it was so traumatised. So that was a very traumatic sort of event. Then I had to go back in a week to have plate and screw put in. Wonderful surgeon, all went really well. And been struggling really ever since. A few episodes of, I was in a boot for 2 months, no weight bearing at all. When I got into physio, and even before that, you could take the boot off and try and move the foot. I'd have these episodes of very painful burning and a stinging and very sensitive sole of my foot. And I sort of thought it was all part of the process, but it's a month ago those symptoms got a lot worse and were constant. So I had a lot of burning pain, a lot of nervy sort of pain, stinging. I couldn't touch my foot, I couldn't put bare sort of weight on my foot, it was so sensitive underneath. It would turn a really weird sort of blue-red colour, very swollen, a lot of inflammation, and it was starting to move through my body. The sort of nerve sensation would be travelling up my shin and my calf and into my thigh and into my other leg, and my right foot was sort of going out in sympathy, exactly the line of where the surgery was. So I went to my GP and she said, look, you've got reflex sympathetic dystrophy syndrome, where your brain can't come off the sympathetic response to this trauma site, and it keeps sending signals that it's in trauma and it's in pain and it has to relieve that. So that causes all these symptoms, and it's like a cycle, a highway in your mind that's triggered by a very traumatic accident or surgery. And it's very, very hard to break the cycle, she said. So she gave me NDEP, 10 milligrams, which I didn't take for the first few days. When she said, you've got to break the cycle, I thought of you, Chris, and coming to see you. After one treatment of physiokey and one NDEP, my foot had settled down tremendously, colour had returned. It's so dramatic, the change. And it's just continued to get better. I've had 4 treatments now. I'm starting to bear weight on my foot naturally. I'm still on crutches, but it's so much more stable. Every treatment it gets better. The movement has been extraordinary. The way Chris very skillfully helped me move my foot using the physiokey, using his experience and knowledge. I'm moving the foot almost as good as my good foot now. And these results are really something you've got to see to believe. Physiokey is sort of outside the box of sort of traditional sort of mechanistic medicine. But if you're suffering from any sort of pain condition or injury, I just really encourage you to come and see Chris at NS Health Australia. I just couldn't say a bigger thank you to both Chris and Licia for all the help they've given me in my recovery. Here I am, a month after first seeing Chris, not being able to put any weight on my foot, and I'm walking beautifully. Hi, it's just 2 months after I first saw Chris, and I'm walking beautifully, no pain, and just absolutely thrilled with the result.